This episode of Life After Injury has been brought to you by Fornos Law Firm, devoted to optimizing your legal results.
Hello everyone, welcome to PushRem, Life After Injury podcast. This is episode 4, Bladder and Bowel Care Management. I'm Ray Pizarro.
I'm Boris Del Cid.
And I'm Richard Bell.
We want to thank everyone once again for sitting in on our discussion and being able to share our experiences with this the stinky topic, so to speak, at times, which is our bladder and bowels. So it's a little bit taboo. It's hard to speak in public about these issues. Some people are sensitive to these things, but I think it's something very important that we should address. We're going to start off with Boris, and maybe talk about how you deal with your, bladder management.
Yes, actually, bladder management was taught to us, or at least to me. Obviously, everyone gets it, but at the hospital. So we have to have catheterization because we can't maintain urine in our bladder for a long time. We have problems with incontinence. Some of us, we cannot hold it, and some of us hold it too much. Not intentionally, but that's what happens when we have spinal cord injuries. So in my case, I used a self-contained catheter kit, which has gloves, iodine swabs, and a disposable lap napkin. I catheterize 4 to 5 times a day as prescribed by my urologist. And this is used to reduce, that program is done so I can reduce the incidence of UTI. I also wear a leg bag with a condom catheter to manage my incontinence. That's it. Rich?
Cool.
All right. Yeah, when I left the hospital, I was sent home with barred catheters. They gave me a schedule too, every 4 hours. But after a while, I realized that when I had to go, I got dysreflexic and started to sweat, got the goosebumps and all that good stuff. So from then on, I knew when I had to cath, and that's when I did it. I continued with the bag and the whole bag and system catheter set. But I switched to low fric because it seemed to give me less bladder irritation, which was great because it reduced my chances of getting a UTI. When I first got home, I would get UTIs frequently. So I would be hospitalized for it about once every 3 months or so in the beginning until I got my technique down. So those of you who are first injured, it's it takes a while before you get the flow of things. But after I got my medications right, instead of taking like Detrol, which cause dry mouth, then I went to Oxytrol, which is a patch. It caused I believe it was responsible for a lot of edema. And then from there, my new urologist introduced me to Gelnique, which is they come in little tabs, and it's like a lotion, and you rub it on your stomach until it gets tacky. And ever since then, it seems to help with relaxing the sphincter, so that I can hold more urine, and it also helps prevent frequent UTIs. I haven't had a UTI in a while now. I mean, you get them, but I haven't had one bad enough to be hospitalized. So, how about you, Ray?
Wow. Yeah, for myself, I remember leaving the hospital with both external condom cath and a routine of intermittent cathing, which I also, my urologist suggested 3 to 4 times a day, depending on your, water intake. Summer days, you're going to drink a little bit more. You're going to have to cath a little bit more. So you just have to remember to do that frequently, like you guys mentioned, for being able to empty out and work that bladder muscle out, because what you don't want to do is let that bladder shrink and not be able to hold a lot of urine. And also, Boris did touch upon a subject where you don't want to hold too much, because then you could get into some serious trouble with, your urine backing up into your kidneys.
Right.
And kidney infections are no joke. Those are really, really serious. One, you could have kidney failure and dysreflexia and have a stroke. So it's really important to keep that, do it very religiously. So basically, I got sent home condom cath, and once I was full, they told me to empty out my bladder intermittently so I can get everything out. Because in some cases, using just a condom cath was not enough. The bladder didn't empty out completely, and that's what you needed to go in intermittently with the cath to be able to, get everything out of there. Because the more urine you leave in there, it's very acidic, and it fermentates, and more bacteria builds up. So so far it's been working really great for me. As far as catheters go, I tried all the major brands, and a good one that's been working for me was a Cure catheter, which has polished eyelids. It's free of a certain chemical that causes cancer, and just a lot of benefits. But that's another show we're going to get into is talking about these different catheters and catheter options.
Yeah, and also other options like some people have suprapubic, which is a surgery that you can get make it easier for if you have limited hand use to cath yourself. And there's a couple of other ways. Some people have a Foley, which I recommend against, because it seems like you get a lot more bladder or bacteria buildup. But
ultimately it's up to your doctor. Your doctor
Yes.
and your urologist is going to dictate what system is the best way to go for you. So any changes and stuff you want to make, you always consult with your doctor, your urologist, or your general doctor. Would you agree, Boris?
Absolutely. We could actually expound on all these subjects and go as detailed as we want, or as simple as we want, which we'll be prepared to do whenever, we're ready for that. So,
right.
We can dedicate a whole program to it. But
yeah,
like Ray said, everything that you hear in our podcast, please check with your doctor, your urologist or your internist. What worked for us may not work for you.
correct.
And in no way are we diagnosing or treating or suggesting that you change your already prescribed habits or routine. So I just wanted to clarify that.
Definitely.
We are all in agreement with that. So
Yes, definitely. And that's, if the newly injured, especially for the newly injured. So any questions, you go to him and you guys sit down and communicate these different options. And if you guys come up with something that might work for you, then that's when you go ahead and make changes. Your doctor will direct any changes that will be made. So, we're that was a little brief, insight on our bladder care and how we deal with it.
Mm-hmm.
Now we're going to go ahead and talk about,
something a little stinky.
some a little, uncomfortable to talk about at times, but it's something we have to do and have to face. So we're going to be just as honest as we can and hopefully not get too detailed in all the stuff we had to go through. So Boris, what is your, how do you go about your daily routine as far as your bowel care goes?
Very simple. As I was taught at the hospital, they taught me that I needed to keep regular as much as possible. So on a daily basis, I will do my bowel program. For some individuals, it may not be on a daily basis, and that also has to do with how long your injury has gone for and all this stuff. So again, for me, it works every day. For that, I definitely have to use a suppository. There are various ways of doing this. The suppository lasts about between 10 and 20 minutes to dissolve. It's introduced digitally, and then you just relax and wait until it takes its effect. There's another way of doing it. There's a little bit of an enema. It's called Enemies, no plug intended, because that's the name of the product. But this one actually is a little bit of a mini enema, and it's the liquid is then introduced, through your rectum, and then is squeezed out, and then the actual stool absorbs it, and it makes it increase in its size. That increase in volume stimulates the tissue inside of your rectum, and then that actually starts a movement. So that one has to release residuals, because when it's done, it's done. The suppository actually irritates the tissue inside, in the anal cavity, or the rectum. And it's known that this suppositories continue to irritate this tissue for 30 hours. So you might have some residual. You got to make sure that the residuals are taken care of by digitally stimulating and evacuating that residual. So that's one of the things to pay attention to with the suppository. And then there is the digital stimulation, which is, basically going in yourself and try to get some movement going with your fingers. So I do it every day. It takes about an hour. You should really avoid staying in there for too long, more than an hour, because then you can start accumulating hemorrhoidal tissue. That's how hemorrhoids occur, and it's something that you want to avoid. So that's it.
Yeah, cool. Mine. I left the hospital with suppositories. That didn't seem to be too effective for me, one way or the other. But my wife has to do mine because I'm a quadriplegic. Sorry, honey. But she I guess she does digital stim, so she takes my manhood every day. But we try daily, maybe not with much success, but we give it a try. There's the occasion where you have an accident, where you're out. It's not a fun experience, but you just blame it on somebody else. I mean, what can you do?
It's part of life.
It's part of life.
Right.
But that too, I begin to be aware of when I had to go, when I would get autonomic dysreflexia. And it felt different. It feels different than urine or pain. When I have bowel, the autonomic dysreflexia is intense and scary. So whenever that happens, I know, it's time to go. But with the regular bowel program, daily, what I wanted to mention, diet makes a big difference. I had to cut out all the fast foods. We eat as naturally as possible, organically as possible.
Lots of fiber.
Yep. And religiously, I try to eat kosher as much as possible, which helps. One thing that was I noticed that made a huge difference was some butter we get at a little French shop. It's Normandy butter. I don't know. There's different brand names, but if you read on the package, if it says Normandy butter from France, for some reason, that's
works for you.
Oh man, it works for me.
Yeah.
I don't know if it worked for anyone else, but definitely works for me. I wanted to mention there's some medications that could cause some problems with your program. That would be like morphine, Vicodin, Narco, or any opiates or painkillers. Yes. They usually cause you to have hard bowels, which causes extremely awful autonomic dysreflexia. You don't want to mess with that. So just keep that in mind if you have to be on those medications, that could be causing some problems. So, and also, as always, consult with your physician.
Yes.
That's right. So, as far as my bowels go, they give you a brief trial and test when you leave the hospital and let you know how things work, and you have to learn how to incorporate that when you get back home. So for me, it was the stimulation, manual stimulation and suppository, and there is a difference, not your average suppository. I learned that maybe 2 or 3 years down the road that there's another type of suppository that cuts your bowel program time in half. In some cases even more, which is they call it the magic bullet suppository. I believe that one is vegetable oil based. I could be wrong, but they have different chemicals in there that allow you to for it to activate a lot faster. And it is a bit stronger. So I just use half of it because it's really, really strong. So, that's something else you could look into. I don't know if you...
I think that's the one that I was talking about, that it does, as you said, it's very strong and it can irritate the tissue, inside in your, rectum, and it can stimulate it for as long as 30 hours. And that's the one that I use as that magic bullet.
Yeah, magic bullet, because your average one has some green writing, which is bisacodyl or something like that with green writing, which in some cases could take you an hour for that thing to activate. And you don't want to be doing your bowel program for more than an hour, but you also got to make sure you get all that stuff out of there too. You don't want to be out in public and all of a sudden you start smelling something funny and it's you. It's that residual from that suppository that was left in there.
Yeah, the goal is to avoid cold browns. That's the goal, right?
Exactly. And we all know what cold brown is. Use your imagination, but yeah, that's one of the the routines I use and have good results. Now for me, I started doing it every day. And about a year after my injury, things started slowing down. I didn't have good results. So my management was every other day. And I haven't changed since then. I have good results 90% of the time for myself. Again, it's the way your body, you got to pay attention to your body because everyone's body is different. And also how much, fiber is being put in your system. I have this thing where at least 3 times a week I have to have my oatmeal, my raisins, and some flax seeds in my oatmeal just to keep everything, running smooth. Because, we all know when you get backed up in your bowels, really, really important, man. You get bleeding sometimes and it could be scary. And like Boris mentioned, you could cause some hemorrhoid issues and other stuff can develop. So, would you guys agree on that? Having that fiber in you either via salad or some soft stuff in your stomach would be able to, make it easier for you.
Absolutely.
Yeah, absolutely. Yeah. The more fiber you have, the better for you for many reasons, but, among them, obviously, to increase the motility of your bowel, especially your large intestine.
Hey,
now, let me just briefly talk a little bit about that magic bullet thing. Like you said, what we try to avoid on a daily basis doing our bowel program is to avoid accidents. And by the use of some of these suppositories, their stimulation of it can trigger a little bit of leakage after you're done your business. So it's important that we check if you use any of those suppositories. And the bisacodyl based ones, you were mentioning about oil coating and things of that nature, like vegetable oil. That magic bullet does not use it's not an oil based.
Oh, it's not. Okay.
No, it uses that bisacodyls. That one actually it's straight goes straight in contact with your with the tissue inside your bowel.
Okay.
And it dissolves real quick.
Okay.
Oh, you know what? I was gonna ask, do you guys have any techniques that you use when you feel a UTI coming on? Like for me, it's D-Manos. I take the tablets, the pills, and
That's to prevent.
yeah. Well, when you start feeling, how you start feeling weak and
Right.
before you have a full on,
Full blown.
yes. So, yeah, for me, I do, the Manos, with a lot of water or Gatorade. I do, there's a tea that you can get at Whole Foods called kombucha.
Mm-hmm.
But, if you don't want to do that, you can also use, this is horrible, but apple cider vinegar, like 2
Not-
tablespoons.
It's not horrible. It's true.
It tastes. I mean, it's disgusting.
Well,
But
you can drink it in different ways. But
well, you dilute it. We dilute it with like honey, a little bit, and just 2 tablespoons in about 8-ounce glass of water.
listen, we can dedicate a whole program about these natural remedies. As a
Right.
matter of fact,
That's another good show topic
that's a-
to
yeah,
add on to the
absolutely.
list, because
Absolutely.
we could sit here and break it down and give you guys more options and tips
Right.
Yes.
on what might work, what might not, and
Yeah, so just drop us a note,
Right.
if there's a question or even an idea you have for a show. We'd love to hear it.
yeah, definitely. And we're getting close here to wrapping up. It's as far as our time is here, but I'd like to give a personal shout out to a good member and a part of our Pushrim family is Pastor Richard. We like to thank him for being a good friend and an active member on pushrim.com, our social networking site. So just want to say a big hello and big
Absolutely.
shout out to him. So
I got another one, Ray and Richard, that
yeah.
I like to thank very much. It's one of our I guess, contributor and benefactors here.
Yeah.
Tim Allen, thank you so much for the comments. We really appreciate your feedback, and thank you for helping us and being a part of our program. You know what I'm talking about. Thank you so much,
Tim, thank you.
Yeah, thank you for
Absolutely.
sponsoring us. We appreciate it.
Yeah, all these sign, all this help that we get is just going to go back into the show and try to make our show a little better and hopefully make it grow into something a lot nicer for you guys. So this is you guys' show. We build it and mold it around you. So Rich, in closing, dude, you want to let everyone know where they could find us?
Yeah, you can find us at Club Pushrim on YouTube, and of course on Pushrim, www.pushrim.com. I always try to post these up as soon as Ray edits them. I post them up on the blog section, so you can catch all of ours there.
Cool. And
Yes, basically, subscribe, watch us. We're doing our best to get these podcasts once a week at least, and we're going to be covering a lot of subjects. So please subscribe, tell others, and enjoy.
thanks. And yeah, we're going to be on, that's on YouTube. So
Yes.
Club Pushrim on YouTube. So
Absolutely.
yeah, so we're going to cut it, let you guys go for now, but we want to thank everyone for tuning in, and we will catch you on our next show.
Right on.
Hasta la vista.
Take care. Peace out.